My name is Isabel Trojillo. I am a junior honors nursing student at Marymount University, and today's presentation will be on nutrition practices in the healthcare industry, identifying barriers, innovative programs, and a call to nurses. Basically, the presentation will be divided into 6 parts, the first being the prevalence of chronic diseases and nutrition implementation, nutrition instruction in medical education and effects on medical professionals and their patients, current and possible solutions, nurses as a nutrition frontline, and the conclusion. The increase in preventable chronic diseases in the United States is slowly killing a population that is in dire need of change. The percentage of US adults that suffered from obesity in 1999 was 30.5% and increased to 42.4% in 2018. Within almost a decade span, obesity has increased by almost 12%, affecting close to half the US population. In addition to a rise in prevalence, healthcare costs are astonishing, as the estimated annual medical cost of obesity in the United States was $147 billion. These statistics highlight the urgent need to emphasize and implement lifestyle changes in the healthcare system in order to save costs and their lives. Metabolic syndrome is a condition that is a pathway between obesity, cardiovascular disease, and diabetes. Possible prevention of METs involves healthy lifestyle implementations, such as exercise, smoking cessation, and consuming a diet that consists mostly of plant-based foods. Although chronic illnesses are influenced by a multitude of factors, including socioeconomic, behavioral, and genetic, many are still preventable with lifestyle changes. With a focus on obesity, recognizing that METs plays a significant role in developing other chronic diseases is critical to understanding possible yet effective prevention methods. Overall, a shift towards a healthy dietary pattern and consistent exercise is overdue for many Americans since they consume the standard American diet, one that consists of foods high in sodium and added sugar and processed foods. Exposure to repetitive fast food advertisements and the introduction of unhealthy, quick, and easy meals have contributed to poor lifestyle choices that start from early childhood. Ready-made, processed foods coupled with the reliance on medications is one of the driving factors in the increased number of preventable chronic diseases. According to a study conducted in 2009 to 2010, 57.5% of calories of the average US daily energy intake came from ultra-processed foods. Aggressive marketing by the fast food industry, in addition to the parental practice of using food as a reward, creates addictive behavior. As a result of reinforcing good behavior with food, a drug-like effect is stimulated, promoting a concept called sensitivity to reward. Maintaining healthy nutritional intake levels as a young child may prepare them for a healthy adolescence and childhood. Healthcare providers have an opportunity early on, even during the gestational period, to impact individuals' understanding of how nutrition can influence their health. The association between maternal weight and the weight of their children correlates significantly. Hence, both prenatal and maternal variables can increase the risk of obesity in even the youngest of children, long before social factors have an influence. By recognizing that the risk of chronic disease can start as early as conception, nutritional and lifestyle education can start during the prenatal period, allowing a possible window for intervention. Improved nutrition literacy by the family as a whole, starting with parents of young children, can likely lessen a child's chance of developing a preventable chronic illness. Skills gained through formal nutrition education is possibly associated with improved nutrition literacy, such as reading food labels, numeracy skills, categorizing foods, and food groups. Thus, medical professionals can work with parents and their children to guide them towards healthy nutritional practices by gaining ample nutrition literacy. Nutrition advice and guidance were given to patients by a healthcare provider. Regardless of their specialty, they can encourage sustainable dietary lifestyle choices. Yet many healthcare providers do not feel confident in giving nutritional advice. Medical education tends to emphasize treatment rather than prevention. According to the National Academy of Sciences, the minimum required hours of medical nutrition education is 25 hours. However, roughly 29% of medical schools meet this minimum requirement. Doctors in medical schools thus lack adequate instruction on how nutrition plays an instrumental role in their patients' health. In relation to the number of hours taught is also the quality and type of instruction given. Since the majority of reported nutrition education hours occurs during preclinical training, nutrition instruction is often integrated into other courses or taught as a separate course without direct clinical application. Insufficient instruction may be the source of why graduate medical students feel uncomfortable emphasizing prevention. A challenge that health professionals constantly face is translating what they know into practice. Several possible sources that contribute to deficiencies in nutritional instruction are the obstacle of integrating these courses into respective healthcare professional curriculum, lack of clinical nutrition implementation, and lack of faculty who can lead in a clinical setting. Faculty members lack applied clinical nutrition expertise, resulting in potential inadequate clinical application given by their students in the future. Healthcare professionals during their undergraduate and graduate programs confess that they feel ill prepared to teach preventative nutrition interventions to their patients. One can infer that the most of the focus of their study again falls under their focus specialty in their curriculum, addressing treatment rather than prevention. Overall, it is apparent that those entering the healthcare field are lacking not only adequate instructional hours in nutrition, but also sufficient opportunities for application in a clinical setting. Successful integration of nutrition counseling may be difficult to achieve without adequate training. Thus, in order to prepare future medical professionals to use their nutrition knowledge in nutrition intervention, barriers need to be identified. By doing so, solutions can be proposed. Once healthcare practitioners have finished training and are in a clinical setting, they face additional obstacles that prevent them from working with patients to successfully implement lifestyle changes. There are limited financial incentives and restitution for physicians focused on lifestyle medicine, discouraging them to implement these interventions. One possible source of this problem comes from insurance companies because the majority of them do not cover nutritional services. Despite the Affordable Care Act's intentions to decrease disease prevention, focusing on preventative care rather than fee-for-service, insurance companies continue to impose constraints for nutrition counseling. Partnerships with policymakers and the government can call for the promotion of nutrition education that can help reduce chronic disease rates, along with government-funded research that can establish more evidence-based practice. For instance, a possible nutrition intervention that incorporates the government is involving the USDA or My Plate guidelines in school cafeteria food or in programs dedicated to nutrition instruction. A patient's lack of opportunity to receive nutrition intervention also poses a barrier, meaning patients do not have access to nutrition services or programs because it is not covered by their insurance. Patients were reported paying out of pocket for their medical nutrition therapy. Medical professionals are aware of the financial load that MNTs create for their patients. Therefore, although providers understand their role in teaching their patients disease self-management, they do not want to put their patients in financial distress. Because of the possible hesitation that occurs when referring someone to an MNT, the patient in turn does not receive sufficient nutrition interventions that aid in the prevention of chronic or other diseases. This results in approximately 70% of patients who are at risk for developing chronic diseases reporting low lifestyle nutrition management. Patients' behaviors toward implementing dietary and lifestyle changes showcase misjudgment of the severity of their own chronic illness. Some possible sources that attribute to this oversight are the lack of nutritional intervention, reinforcement across healthcare professionals, insurance constrictions, and disregard for future health consequences. Possible solutions to mitigate these barriers that prevent the successful integration of nutrition education in the healthcare field are in the works. For instance, some medical schools now provide 40 to 75 hours of extensive nutrition education by carrying out related activities during their clinical rotations. These changes require strong leadership, innovative thinking, and careful planning. Culinary medicine is a new and creative way for medical students to learn and apply cooking and nutritional concepts. In a pilot study at a medical school, dietitians, chefs, and students created a collaborative culinary nutrition curriculum focused on USDA nutrition guidelines. Students were taught to use their culinary skills and translate them into tools for aiding their patients and themselves in eating better. As a result, medical students were able to accompany their preclinical nutrition education with a more hands-on approach. Shared medical appointments are group visits with medical professionals that are centered around collaborative care. They can improve provider productivity, increase the quality of and access to care, enhance chronic disease management, and potentially reduce provider burnout. Using shared medical appointments promotes lifestyle medicine as healthcare professionals work synergistically with each other toward managing or preventing chronic diseases. Emphasizing effective lifestyle changes can encourage patients to continue and build upon what they have learned. Patients need assistance from their medical team to achieve healthy lifestyle changes. This shared responsibility can be accompanied by self-management systems, which are defined as the process of making and refining multi-level changes in healthcare systems and the community to facilitate patient self-management. The Joint Commission Journal on Quality and Safety highlighted programs that promote shared medical systems or self-medical systems, such as the Chronic Disease Self-Management Program, which integrates SMS through medical appointments by all staff members and uses interactive technology. Moreover, an important feature of SMS is the patient's follow-up appointments, wherein goals for behavioral changes and self-care are outlined by the nurse, educator, or dietitian. The cost of an individual's healthcare can significantly affect the type of medical care and resources they receive. Although costs are seen as a barrier, there are possible solutions. The Affordable Care Act has provided healthcare insurance coverage to more Americans and also decreased the insurance disparity for populations affected with chronic diseases that disproportionately affect the poor. Knowing that prevention through nutrition education by healthcare providers is effective, possible reimbursement and funds can be managed, helping eliminate financial barriers. Projects such as the Dr. Young Project are using the same concept of culinary medicine for teaching patients and their families about the benefits of healthy eating. Dr. Fernando, a pediatrician addressing the increasing rates of childhood obesity, and uses her program to overcome obstacles that prevent her patients from eating well. Her teaching kitchen and garden are models that can be used for preventative nutrition interventions that impact not only the patient but also their family. Dr. Fernando demonstrates the use of research and evidence dedicated to healthy eating and guides parents and teachers to practice her curriculum to pass it on to younger generation. Some of her evidence-based nutrition instruction includes finding easy ways for her patients to implement healthy diets through recipes and cultivating their own fresh produce. Nurses are a critical part of the medical team, and those who are working in primary care are in an ideal position to lead and advocate for programs, specifically nutrition-focused, in order to prevent health complications. Nurses are recognized for having the most communication with their patients compared to any other professional staff. Thus, they have commanding influence. Having an opportunity and time to get to know their patients allows a nurse to understand their wants, needs, and goals. They are thus able to create an instrumental bond in which patients can trust their nurse with their care and plans. With regards to nutrition implementation, nurses can reform their leadership aspect in healthcare to make it more patient-centered and focus on preventative measures. As a nurse, using fundamental nursing processes in order to implement nutrition interventions is a critical yet simple skill. Therefore, they are more than capable of nutrition instruction. Also, through collaborative teams, nurses can work with other professionals in establishing nutrition interventions. Interprofessional care is a partnership with other professionals that work together to provide the best patient-centered care. The use of IPCs can be seen in Dr. Young's project. Her curricula around healthy eating and goal towards preventing childhood obesity are carried out by her team that is composed of nurses and other staff. Nurses aid patients constantly by attending to their fundamental needs. Thus, they often become advocates for the patient. Hence, nurses have access to patient information that is beyond a written prescription from their pharmacist. The integration of public health and primary care nursing principles can be combined in order to address a plan of care for children's nutrition and physical activity and obesity. Primary health nurses involve those who work in schools and thus have the capability to advocate for health promotion to students. Specific to children and adolescents, nurses can provide education on childhood obesity prevention. Their work with children and families creates opportunities for intervention and early prevention. Moreover, public health nurses care for the community since they are aware of their health disparities. Nurses thus have the ability to encourage their communities to employ healthy lifestyle programs such as making healthy dietary changes and regular physical activity. Nurses in both primary and public health care can use the nursing process in order to identify timely health disparities among their patients, promote programs, and empower families to implement interventions. Overall, nurses not only serve on the front lines, but also can be leaders in helping to implement healthy lifestyle changes. In conclusion, chronic diseases that can be managed and prevented by implementing nutritional and lifestyle changes are on the rise. Some legislation has acknowledged the need for more nutrition-focused healthcare interventions, such as the Affordable Care Act, but it is time for the healthcare industry as a whole to keep up with innovative practices. Recognizing and pushing toward a progressive generation of healthcare professionals who are prepared and educated in addressing chronic diseases and facilitating their patients toward positive lifestyle changes is overdue. Schools need to advocate for the importance of nutrition education during preclinical and the clinical setting by increasing the quality and quantity of their students' preparation. There also needs to be more research to see which method of training is the most effective to provide adequate nutrition counseling. However, evidence of current projects and interprofessional collaboration that advance nutrition instruction showcases that it is possible and can be adopted by the entire healthcare industry. Lastly, nurses transform their patients' care into something meaningful and personalized. Thus, seeing that they have a valuable and considerable influence on their patients' dietary health practices is essential. The healthcare industry currently falls short of its potential to prevent and manage chronic diseases. The power of intervention is already acknowledged by some, but it is not universally applied. Changing the way patients and healthcare professionals approach and use nutrition is a step forward. So that concludes the presentation. Thank you. If you guys have any questions, feel free to email me. And here are my references. Thanks.